Coming up on the Doctor's Hospital podcast.
Nowadays, we have to understand that children do go through an enormous amount of stress and anxiety, and we have to be able to validate the child's worries and concerns.
Experience the immediate care you deserve at Doctor's Hospital Urgent Care. When emergency strikes, trust our expert physicians for fast, quality care. With extended hours and cutting-edge medical technology, we're always ready to serve you. Don't wait or take risks with your health. Visit our urgent care suite at Doctor's Hospital West on Blake Road for immediate, trusted, and best care.
Welcome to the Doctor's Hospital podcast. We are back continuing our back to school podcast series. And if I'm not mistaken, this is the conclusion of our back to school podcast series. And we're happy to be wrapping up our series of conversations with one of our very own psychiatrists here at Doctor's Hospital within the health system, Dr. Rashida Brown-Clarke. And she's joining us today to talk about mental health and emotional well-being. It's something that is a critical component as we talk about, young people especially. All of the pressures that come along with being in school, if they're an athlete, if they're involved in extracurricular activities, there's so many things that come into play with that whole experience of being back in the school environment and all of the different pressures that come along with it, from academics to athletics and everything else in between. So we wanted to get you on, Dr. Clarke, to talk about, what it looks like, how parents and even sometimes people within the educational system, teachers, guidance counselors, is giving them some information, some tips and some hints on how to help manage through this process. I think a lot of times, I grew up in a generation and basically anybody older than most of our parents would be like, y'all don't have stress. Y'all don't know what it is when we were kids, right? And so for some people of a certain generation, this is like, these kids don't have stress. They don't know what that is. But I think you'll find that as we discuss through this, I think there's a lot of information that indicates that indeed, even our youngest of babies sometimes have stress, just depending on home environment, school environment, what they're plagued with. And so we're here to talk to you and get some help in navigating that conversation. So welcome to the show, and we are grateful to have you on.
Thank you so much for having me.
So let's dive right in. Before we even get into being in school in particular, what are some of the key signs of even back to school anxiety in kids and students, and how can parents intervene early? Because I think sometimes we think about it like, it's when the actual pressure is on, but sometimes you have anxiety just going into it.
Definitely. So, some of that nervousness about getting back into school would be considered normal. So there would be some anxiety or nervousness about new routines, new teachers, new friends, and what those social interactions will look like.
Right.
And a lot of this is normal, as I mentioned, but it should kind of go away and resolve within a few weeks of starting school. So it can start before, but once they're back into the school system, it should kind of diminish within a few weeks. But what would be a cause for concern is if you start to see the child having tantrums. And I tell people all the time that tantrums are normal for a 2-year-old, but when you're 4 or 5-year-old is throwing tantrums, not so cute, not normal,
right.
At all. So when they are separating from caregiver or parent and going to the teacher and they're throwing tantrums, that's when you have to be a little more concerned about the stress and anxiety that they may be having. When it's difficult for them to get along with family or friends, so a lot of behavioral issues with families and on the playground, that can be a sign of anxiety that is a bit more than what would be considered normal. And then when they're avoiding their normal activities in and outside of school. So somebody who is an avid soccer player, but they don't want to go to soccer,
right.
and they have all sorts of reasons why they don't want to go to soccer, you would be a bit concerned. And that kind of leads to the whole barrage of physical ailments. I have a stomach ache today. Tomorrow my foot is hurting. Then my little toe is hurting. And then my little finger is hurting. And so, they have all of these complaints and it's obvious that there's no real physical cause for the symptoms. That's when we should be concerned and when people should start to intervene.
I mean, as a parent, what about parents who have anxiety about back to school, right? So it's like you think about it from the standpoint, especially I guess parents of younger kids who your kid may be going to school for the first time or even
Mm.
preschool for the first time. What kind of advice would you give them of managing that? Because how do you know the difference between, okay, my kid is just crying because this is kind of like a first time experience, or how do you navigate even that balance and I guess your own anxiety as a parent when you think about stuff like that?
Well, for parents, how you manage your anxiety is going to be very important to the child and how they manage their
That's
anxiety.
true.
So they look for us to for guidance on how to deal with emotions and how we deal with problems that we have, with any stress that we have. So it's just important to take a step back to
Hmm.
realize that you do not want to project
Right.
your anxiety on
Yeah.
this child.
Because if you look like you losing it,
Exactly.
imagine then the kid
It's
who
gonna
who might not be
it's gonna
prepared.
be a total mess when you get into that classroom with that child.
Oh boy.
So if you in tears, he or she is in tears, then we have a bit of an issue. So it's something to talk about beforehand with
Hmm.
your partner or somebody who can kind of talk you down and talk you through things.
Right.
But before you kind of put yourself
Into
out
that
there
circumstance.
and
Yeah.
and show the child what you don't necessarily want them to see.
Hmm.
So we have to be able to recognize our own anxiety, our own nervousness, that drop at the pit of our stomach. And what do we need to do? Do we need to go through deep breathing
Mm.
exercises, meditation,
Hmm.
exercise, eating good, sleeping well? So all of the things that we would want to tell our children and would want our children to mirror, those are the things that we need to do for ourselves.
Okay. And you're giving away some of the answers to my next
Yes,
question.
yes, yes, I realize
But
that.
that's fine. That's what you call a good segue.
Sure.
So what practical tips then? What other practical tips can parents use to help their children or even themselves transition back into the school year?
Now I had to look some of this up, I'll be honest with you. So I did find some of this interesting. I
Hmm.
don't know how practical it is for our setting, but I think some of it we can do.
Sure.
So one of the tips that was given by someone at Johns Hopkins was starting 1 to 2 weeks before school,
Hmm.
prepping for
Hmm.
the transition. And that would be realistic bedtime,
Hmm.
selecting clothes for the next day. So when people are, they're
Mm.
supposed to be getting used to taking out their
Hmm.
uniforms. In American schools where you don't have a uniform, that setting out clothes is what they're talking about. But
Right.
for us, it's just kind of making sure that you understand what is neat and appropriate
Right.
and getting into that routine
Right.
1 to 2 weeks before. And then arranging play dates. So for
Hmm.
your younger children or for your older children, they won't be considered play dates, but social activities with
Right.
peers and people that they will see in school. So that brings that familiarity, a bit less anxiety. Now, this one I say, but I can understand the importance, but whether or not it's practical,
Hmm.
visiting the school before school actually starts.
I think it depends on the age of the kid, right? So,
Yeah.
like, we have a 1-year-old who's getting ready to go into daycare. So, there's an opportunity to
Mm,
go and do a school
true,
visit
true.
ahead of.
Yeah, that is
So,
true.
that may be age dependent, right? Like,
Yes.
you should not feel like you have to do that with like a 13-year-old or 16-year-old.
Agreed,
But,
agreed.
or if you have a kid that's going into a new school, so a school for the first time, if you have a
Yeah,
kid that's transitioning from, well, they went to this school and now they're going to that school,
sure.
um, especially if some sort of abrupt switch like that, I imagine it may be practical there.
Yeah, to at least visit the school. You might not, because they talk about going into the classrooms and kind of practicing that,
Mm.
but a lot of the schools may not actually be open.
Right.
But you can go to the school and maybe just walk around the
Get familiar.
grounds and let them see the new surroundings.
Hmm.
So and that is and a lot of the preschools, daycares, when you think about it, they would be open
Hmm.
a bit earlier or allow people to come in naturally
Right.
just to
So, like I
meet
said, I know our
staff.
experience has been that the we've used the same institution for both of our kids. Was even when my daughter she'd already been there for a year or two,
Mhm.
it still was the same process. You had the ability to bring her in a
Right.
week or two before school opened, just because you're going into different classrooms, so
Yes, true.
familiarizing yourself
Hmm.
with who is the teacher in this environment and getting comfortable, because you're talking 2, 3, 4 years old in some instances before they go into a more formalized
Yes, yes,
situation. But yeah,
yes.
I do think I think it is in that age bracket and that range of schooling, which would be preschool and probably early primary school, at kindergarten, first
where
grade,
you can do
really.
that.
Right.
Definitely. And then also kind of coming up with a prize or reward system
Hmm.
that the child could earn for separating
Hmm.
from mom or dad. And we all know our children, and we know what they like, what they enjoy, and
Hmm.
what would be an incentive for them. I always say every child has their own currency,
Hmm.
and we just need to identify what that is and work with it,
Hmm.
and also validate. So
Hmm.
this goes against how we may have been. I may be a little younger than you, so
Don't mind the gray hair. Stop that. Let me be nice. You're my guest. Let me let me be
I just
nice.
had to throw that in there with your opening spiel.
Mm-mm-mm.
But yeah, I am very aware, and I definitely grew up in that era of children have no stress. You don't have any stress. You don't pay
Mhm.
any bills.
Mhm.
But nowadays we have to understand that children do go through an enormous amount of stress
Oh yeah.
and anxiety, and I just need to kind of put a plug in there that this is where anxiety disorders actually develop oftentimes in
Mhm.
childhood and adolescence.
Mhm.
So that's important to note. And we have to
Mhm.
be able to validate the child's worries and
Yeah.
concerns. So give it a name, explain to them that you understand what they're going through and what they're trying to say to you, and help them with techniques to kind
Yeah.
of get through that stressful situation. And then at the end of it is just you have to consult professional services if after the first month or so the child is not adapting well to the environment, and you teachers, people around them, are really unable to help them with the stress and anxiety.
Okay. It's interesting. We she's still young, but my kid is tends to get excited right before school starts. So, even the idea of getting back into routine, it's kind of a little bit easier. I know for a lot of people that may be challenging, but we found that to be very helpful though. Even just the idea of getting used to, okay, in the summer, if you were going to bed at 9 o'clock, you just start to slowly peel out
Hmm.
closer and closer to your school season bedtime, things like that.
Exactly.
Even the same thing in terms of like some of the types of activities and things that you would normally do, you kind of a lot of that starts to just shift slowly, and we found it to be helpful.
Yeah, no,
Um,
it is very helpful, and it does help to cut down on anxiety. And every child is going to be different. Like my daughter is very excited to start school. My son, not so much. So it every child is going to be a bit different when it
mhm,
comes to those things.
yeah. So you talked about stress, and again, you're very good at the segue. I'm giving you mad props here. You're very good at that.
Thank you.
Um, but you talked about stress a little bit, and the fact that we are seeing more and more the signs of stress in our students, in our kids. So, what are some of the main indicators of stress in children, and teens that parents and teachers should watch out for?
This is very important for younger children. So when we talk about those preschool age children and even younger, they are not really able to verbalize or recognize even when they're under stress. What
Hmm.
what does that mean? What does that feel like? How do I express this?
Hmm.
They don't have that capacity. So this is the age where you see a lot of disruptive behaviors,
Hmm.
where they may be irritable, moody, withdrawn. So those are things that you really have to look out for in that age group,
Right.
or just very, this is where they seem more disobedient, rude,
Mm.
and we oftentimes dismiss it or want to punish
Hmm.
bad behavior when and ignore the fact that they are trying to communicate with us
Right.
in the only way that they know how. So that's where so your younger children, that's what you have to be aware of. And then also, are they more clingy? Are they not sleeping well? Are they sleeping too much, sleeping too little? Are they eating too little, eating too much? So you
Hmm.
can start to see those disturbances in that age as well. For teens, though, they naturally spend less time with parents, or want to spend less time with parents,
Hmm.
and want to spend more time with friends.
Hmm.
But is this teen going out of their way to avoid parents at all
Right.
costs? So they want little or nothing to do with you as their parents. What are they going through? or they are separating and avoiding their normal friend groups,
Mm-hmm.
and maybe starting to engage with peers that are questionable
Yeah.
in terms of what they're doing in their behaviors.
Yeah.
So that may be an indication of stress that the child is going to. And again, I have to come back to the frequent physical complaints. So
Mm-hmm.
you're taking them to the pediatrician every week because one week is stomach ache, the other week is headache, and the physician examines them, maybe does some tests, and everything is normal, but they're still complaining day after day, week after week of different symptoms. That is often a big indicator that something is wrong and this child is probably under stress.
Yeah. I think it's that idea of, if you know your kid, you know what is normal, and
Mm-hmm.
then what starts to look like it
Agreed.
exists outside of the scope of what's normal.
Agreed.
So at what point should parents then consider getting help for their kid?
So you would seek psychological support. I would start there
Okay.
because and this may be a good time to talk about what is psychology and what is psychiatry. So I
Fair.
am a psychiatrist,
Mm-hmm.
meaning that I am a medical doctor and I'm trained to treat severe mental illness.
Mm-hmm.
The psychologist is the expert in talk therapy, is
Mm-hmm.
not a medical doctor,
Right.
but can have a PhD in psychology, master's or PhD in psychology. So the psychologist is often thought to be a good starting point,
Mm-hmm.
and you would want to see that person when you as the parent have exhausted what you can do or what you feel like you can offer the child, or and in conjunction with the teachers, because you're supposed to have a good rapport with the child's teachers as well. So what are
Mm-hmm.
the teachers doing and what has not been working? If what they're doing isn't working, administrators doing is not working, what you're doing is not working, or you feel unable to reach the child and the child is still displaying all of the behaviors that we mentioned, that's a good time to seek mental health services.
Okay.
And sometimes you can start with the pediatrician
Mm-hmm.
and let the pediatrician refer you to a psychologist, and then the psychologist would decide if this is something that they can manage,
Right.
or the
If it
child
goes beyond.
meets the criteria for needing medication.
Okay. Awesome. We are having a great conversation thus far with Dr. Rashida Brown-Clarke, psychiatrist here at Doctors Hospital, on mental health and emotional well-being. We're going to take a quick break for some words from our sponsors, and we will be right back on the Doctors Hospital podcast.
Are you seeking exceptional healthcare beyond the traditional hospital setting? Introducing Doctors Hospital Clinics, your trusted destination for comprehensive care. Our full-service locations provide affordable services through our Loyalty Advantage membership program and NHI. Experience seamless care with our integrated health system, where your medical history travels with you, ensuring continuity of care. Book an appointment today at clinics.doctorshosp.com. We make primary care easy.
Welcome back to the Doctors Hospital podcast. We are continuing our conversation with Dr. Rashida Brown-Clarke on mental health and emotional well-being as a part of our Back to School podcast series. So we're going to jump right back in. We talked about stress. We talked about some of the signs of anxiety and stress in kids and students as they get ready to go back to school. And it brings up a good question of resilience, So how can parents and, educators, guidance counselors, I guess anybody who has influence specifically into a child or a student's life, help them to develop resilience in the face of challenges? Because I think we see that challenges exist in every facet of life that we look around us. So how can parents, teachers, guidance counselors help to build resilience?
I remember a very good friend of mine and colleague. I have not looked this up myself, but I trust her totally.
Mm-hmm.
She said to me that a child only needs one adult,
Mm-hmm.
does not have to be a parent, does
Mm-hmm.
not have to be a guardian, one adult in their lives to help them become resilient. Just that one source of comfort and safety
Okay.
that can come in the form of a teacher,
Mm-hmm.
guidance counselor, but to help them build resilience. But for a wider view, yes, definitely parents, guardians, teachers can help build resilience in children, and that is through just making connections and connecting with your child.
Mm-hmm.
So making sure that they understand that you are their safe space, that you understand what they are going through, that you can teach them how to be empathetic
Mm-hmm.
towards others. Also helping them to learn how to help themselves.
Mm-hmm.
So we are in an age, and I think I'm not the best at this either. I think we're in an age where we do everything for our children. I remember when I was growing up, I would go home. I'd be 11. I'd have to go home in the house by myself, season whatever meat was there that my mother
Mm-hmm.
had, put that into the oven, cook the sides. I had to do for myself. I had to make sure my homework was done. But now we do everything for our children. So helping them to be able to do for themselves. So when they make mistakes, how do you correct those
Mm-hmm.
mistakes and how do you learn from those mistakes? Also having a routine. So very important is making sure that children have a routine. Children thrive from routine
Mm-hmm.
and having a structure. A lot of quote unquote bad behaved children have said that they would like for somebody to be there to give them something to do, tell them what to do when they need to do it,
Mm-hmm.
and to correct those behaviors. But we just let them be. So having that routine and that structure is very important. And then also making sure that they do have some unstructured time. So there's structure and
Mm-hmm.
routine, but there also needs to be some unstructured time where they could just be a child and they could
Mm-hmm.
just do whatever they want to do and use their imagination. And that's where you have to take technology away
Mm-hmm.
sometimes, because that does
Mm-hmm.
not help with creativity nowadays. So making sure that they can play, art, work, whatever it is that helps to kind of build imagination and is not really structured, and take care of themselves. What do they need to do to also be able to take care of themselves? Because
Mm-hmm.
that helps with resilience. If I can take care of myself, if I can do things for myself, if I can learn from my mistakes, then that helps me to build that wall of resilience. And then also to have goals and move towards goals, be able to set goals, move towards them.
Mm-hmm.
That also, and then be able to navigate when you don't meet those goals. So when you fail, how do I deal with failure, and show them appropriate ways to deal with failure, and not allow them and ourselves. We cannot punish, or should not overly
Mm-hmm.
punish, and we should not use words,
Mm-hmm.
because they need to understand that words are important, and we need to understand that the words that we use for them, towards them, are also very important.
No, that's fair. It's funny you talk about walking home and yeah, that's I think nowadays people would act like that's child abuse. What you just laid out as your after school
Exactly.
routine.
You yes, you
But
can.
oh no, definitely like walked home from SAC parcel, many days in as early as seventh grade, with a key to the home,
Mm-hmm.
nobody there. You go home
Mm-hmm.
and same thing, you gotta
Get
clean
dinner
something
ready,
or do this
clean
or do
up.
that.
But we don't. I see parents walking in with their children, and the children as old and big as them, carrying their bags for them,
Hmm.
holding their lunch bags, their
Listen,
clothes. We've really gone.
see, I so that one. So I like again, my daughter is 6, so I say this from the standpoint of I struggle with that in particular because like I remember, I think when she was going into formal school for the first time, and they're like, "Oh, I'm her dad. She's 5. I'm gonna carry her bags. If I feel like carrying her bags, I'm gonna carry it." Now, I will let her carry her bags every now and then. But it's like when the school want to bring 4 bags to school and she's 5,
Yeah,
she
now
can't carry the 5, but she can't carry the 4 or 5
I don't
bags
know
by
where that
herself.
has come from, because nowadays it's like they have to carry their whole lives on
Listen,
their back.
there's a backpack, a lunch tin, a gym bag, a homework bag, and I'm like, why does the kid need 4 bags? But I say that to say, yes, at a certain point, so I have to wrestle with that. I'm like, at what point is it that, okay, I pull back? Because as a dad with a daughter, you feel like, there's this thing that you want her to know that dad is there to protect and help.
Sure,
And at what
sure.
point do you shift that to say, okay, you can stand on your own? Because to me, 5 is early for that. You know what I mean? But at the same time, it is something that I hear and I'm kind of like, okay, so some days I let her carry him, sometimes I carry him. And that's kind of how I balance it for now.
I don't know. It's different. I do some old school things and some new school things, but I am very, very old school with that whole walking up and walking in with your own stuff.
Yeah, I remember when people used to talk about helicopter parents, and I'm like, boy.
And however you get that up there, and however you get that in the classroom, whatever that uniform looks like when you take that out of that Ziploc bag, I can't help. That's on you. I can't help you.
That's funny. So getting back to the meat of our conversation. So how does early intervention play a role in fostering resilience?
So early, well, you have to start early. We talk about old school, but again, I have to say that we have learned that all of that is not always good. Some of that is good, but some of what we now understand as kind of new language, new skills are very important. And so we have to start recognizing things with our smallest children and working on them when they are very young. And just kind of watching them letting them understand again that we are where they are supposed to feel secure. So make sure that family is involved, make sure that you spend time with them, make sure that when they are crying or they seem stressed or something is going on, that they want to come to you, they want to spend time with you, they want you hold them, you love on them, and you play games with them. So it starts very young, and it has to start when they're very small, so that they understand and they grow up with that mentality. And as they get older, then you speak to them in language that they understand, and you speak to them in a way that they will understand. And modeling behavior is always going to be very important. So what you do, I said this to somebody recently just for grief. I don't know if really, yes, because that's a part of being resilient as well, being able to deal with things like that and heavy emotions like that. But let your children see what you are going through, how you are feeling. Let them see you cry, because you're modeling appropriate responses to strong emotions. And that helps with resilience. That helps them to learn how to deal with things.
There's a story that I'm not going to tell. Yeah, there's a story that I'm not going to tell.
Okay.
All right, so this next question, I feel like we've covered sleep a lot in a couple of different elements of this series. So I'll streamline this question to one particular element, and that's, how does sleep impact the child's mental health?
So sleep is very important. Sleep is very important. Like you say, stories that you shouldn't tell, stories that I won't tell, but sleep is very important. And sleep, a good night's sleep helps us all. Children are no different, to be able to focus, to be able to concentrate when they get into school, and helps with their academic performance. So
Right.
if you're well rested, you are able to take in that knowledge, you're able to retain it, and then you're able to process it and do well with whatever evaluations that you have. When you don't sleep well, you're moody, you're irritable, you cannot concentrate. Small children especially, become very disruptive in the classroom. And that's all because they're just too tired. They're just too tired to sit and do the work.
Can't function.
No.
All right. So let's jump down towards our final segment of conversation. We've talked about earlier on the difference between psychology, psychiatry, things like that.
Sure.
But looking at how can mental health support services assist in managing anxiety, stress, building resilience. So basically, everything we've talked about. Where does mental health support services fit into that?
So you have mental health. You have mental health already in your in most schools in the form of a guidance counselor.
Mm-hmm.
So that person is really there to be able to help facilitate good psychological and mental health. And so having a well trained person in those schools in those areas is very helpful. And just and then they kind of lead the charge in terms of the need to refer
Mm-hmm.
to other formal mental health services outside of the school. And the pediatricians should be used, guidance counselors should be used to help to decide who does this child really need.
Mm-hmm.
Most times, a lot of this can be done through a therapist or a psychologist. Does not rise to the occasion of needing a did I say psychiatrist? I meant psychologist. So
Mm-hmm.
this it starts with a therapist, psychologist, and then that person really can be the one to determine. Well, this is a little more. This
Mm-hmm.
child has a significant anxiety disorder, obsessive compulsive disorder, or even a major depression, depending on the child and the circumstances,
Right.
and I've done as much as I can do when it comes to therapy and specific therapies. This child needs more, and this child needs a psychiatrist to be evaluated for severe illness and the need for medication.
Mm-hmm. And we've been talking a lot about this from the standpoint of going back to school. But how important is follow up in maintaining mental well being throughout the school year?
You should. So once you are engaged with a so there's always a plan. So for me, for a psychiatrist, there's always a plan. There's research as
Mm-hmm.
well as the individual. So research says if you start medication, you should be on medication for this amount of time.
Right.
And in this amount of time, I need to see you every 2 weeks, monthly, 3 monthly, every 6 months, depending
Mm-hmm.
on the person. So there's no necessarily set time,
Mm-hmm.
but follow up is important. So taking medication is not just I give you this medication and you go off into the wilderness and you take it until it runs out,
Right.
and then that's it. There has to be some sort of follow up. The same with therapy. I'm not a therapist. I'm not a psychologist, but you set out a plan with the therapist, psychologist, and that's what you're working towards, and they'll be able to tell you how often to follow up. So follow up has to be there.
Okay. And then I guess I think you might have touched on this here and there throughout our conversation. But if anyone listening who might not quite know or understand even through what we've talked about so far, can you kind of just explain, when and why a child might need to go, beyond just their school guidance counselor or beyond a psychologist and actually need to see a psychiatrist for these sorts of
So
issues?
when they've exhausted what the therapist, the counselor can offer,
Mm-hmm.
and they're not improving. So
Okay.
the symptoms, the signs are persistent
Mm-hmm.
or worsening,
Okay.
and it is disruptive. It's causing the child a lot of distress. So
Mm-hmm.
you're noticing worsening in behaviors, worsening symptoms, and they are actually possibly becoming a risk to themselves or others because of what is going on with them. Then they probably need a bit more than just what therapy can do,
Mm-hmm.
and they're not functioning. So that's another important indicator that this child, despite all of the psychological interventions, is just not functioning as well as you would expect them to academically, socially, interpersonally, in their family. That child should be evaluated. People get a bit wary because they feel like once you see a psychiatrist, they can put you on their medication, and the
Mm-hmm.
medication could pull you up. I hear that all the time. But going to a psychiatrist does not always mean that you need to be on medication.
Right.
Sometimes, yes, medication is necessary, but I may be able to say, well, okay, no, I think that this child can do well in therapy, but maybe we should consider a different type of therapy, or
Right.
maybe we should consider a different therapist,
Mm-hmm.
because it all depends on the rapport that the child has
Mm-hmm.
or adolescent has with someone. And same for psychiatrists. They
Mhm.
come to see me, they like me or they don't like me. And then, you say that, okay, you should see someone else.
Mhm. It's another story I won't tell. But yeah, you're right. I mean, I think even that last part about knowing, just if it's just not the right fit.
Mhm.
And I think if you're looking to, have the best result for the patient, even sometimes from the therapist or the psychiatrist standpoint, it might be to proffer, maybe I'm not the right fit.
Mhm.
Maybe there's something in the engagement, the interaction that doesn't quite
Definitely.
work.
Definitely.
And I think that helps because rapport is important.
Yes.
I was discussing this study this week about the importance of belief in the process of even taking medications, and basically the more that a patient believes that something is going to work, the more likely it is to work. And there's a full study
Mhm.
behind it.
Yes.
But I think it's important to kind of note that sort of thing, because having a bad rapport may cause someone to think this is not going to work, and
Definitely.
that has a
Definitely.
big impact on the whole thing.
So everybody has to know what their limitations are and when they need to be able to verbalize that.
Mm-hmm.
And that's on the side of therapist, psychiatrist, patient,
Mm-hmm.
when things are not working and when somebody else should step in or you should
Mm-hmm.
refer to someone else
Mhm.
to get the answers that you need. And we should not consider that as a failure on our part,
Right.
because it's all about making sure that this person gets the help that they need.
And that's it.
Mm-hmm.
At the end of the day, it's about patient-centered care,
Yes.
patient-focused care.
Yes.
All right, I want to thank you so much, Dr. Rashida Brown-Clarke, for joining us today.
This is why when you just use Rashida, you're
It's
good.
a lot easier.
Yeah,
You're
yeah.
right. But I want to thank you so much for taking time out of your busy schedule. We've had a great time on the podcast these past 5 weeks, doing this entire conversation through back to school. So I want to thank all of our guests who have been on over the course of these 5 weeks, but especially to you, our final guest in this series, for talking through mental health and emotional well-being. You've been a phenomenal guest, both for our on-air and off-air conversations.
This is where the age shows.
You know what? I wasn't gonna say this, but when you use carpuncle up like that, it shows, because I think that's everyday language anymore. So that you told your own age right there. Don't look at me like that.
Oh, fighting words. Fighting words. Anyhow.
I'm reminded that we are offering, for those of you who have not yet done your back to school medical examinations and things of that note, we do have Doctors Hospital is running a primary care promotion for discounted school medical packages. So that's taking place at our Carmichael Road location, Centerville Medical Center, as well as Dowdesville Medical Center. And there are 3 packages available ranging from $100 to $170 plus VAT. And it includes a host of the different varying things that you might need depending on the scope and scale of the medical examination required by your school or organization. Similarly, we are having a back to school health fair, and this is sponsored specifically out of our Carmichael Medical Center location. That's taking place this Friday, Saturday, August 31st from 12 p.m. to 4 p.m. at the Flamingo Gardens Park. And you can join us for backpack giveaways, a bouncing castle, and face painting for the kids, free snacks, free health checks, and you can learn more about our Institute of Learning, which is our program for education and medical certifications and things of that nature. And we'll also have our LAMP team on site for LAMP sign up for the whole family. So again, that's Saturday, August 31st, 12 p.m. to 4 p.m. at the Flamingo Gardens Park. So thank you again, Dr. Clarke. We'll have to have you back on. I think there's a wealth of additional conversation that we can have around this space.
Thank you. Thank you for having me.
All right. And to our listeners, as always, we invite you to like, comment, subscribe, and most importantly, share. And we will see you back here next week on the Doctors Hospital podcast.
Doctors Hospital Specialist Clinic is where trusted and best care meets consistency and dedication. Let our expert specialists take you on a healthcare journey where warmth, compassion, and your well-being come first. From diagnosis to prescription, we are with you every step of the way, ensuring your peace of mind. Visit us today at Centerville Medical Center, Collins Avenue and 6 Terrace, and discover quality, compassionate healthcare at Doctors Hospital Specialist Clinic.